So this is our last day of surgery at Sadar Hospital in Sylhet, and I am going to walk around and introduce you to everyone on the team. So, hang on. Alright, so in this operatory is Amy Tanchik and Jose Marquena with Dr. Imre Rede and Imre Jr.
Dad, why did you pick this release here? I'm just curious. Why did you pick that point in particular, not like here or here?
For an incomplete, it'll come in better, I think. It's kind of arbitrary, to be honest with you. So this is a unilateral incomplete cleft lip. I mean, we'll take that away and then we'll
see
just,
what happens.
We'll just see. Yeah, okay. Kind of cut as we go, which is kind of how I think this.
No, I think you're right. I'm just wondering how you saw it.
Yeah, a lot of it is just experience. This is our anesthesiologist, Dr. Imre Rede. Very nice. So this is the OR in Sadar Hospital. Our washroom, which currently does not have any water. So we've been using Purell. This is the scrub room. The nurses actually here are doing a great job keeping our instruments clean and turned over. So you can see this is where we keep our gloves. This is the second operatory with Dr. Gregory Bora and Dr. Joe Napoli. Dr. Von Greenidge, Dr. Lisa Ducoin, with a patient who is just intubated. Well, you're getting there.
Alright, thank you.
Sue Walsh, CRNA.
Yeah, ease up off that. I agree.
I'll show you what I mean.
So this is a patient with a significant facial deformity
You threw it out.
who had a lip repaired prior but does not have any nasal support. So Dr. Napoli is going to be reconstructing this.
I'm going to try and make this not twist. Yeah.
This is Ariba, who is our medical student from NYU.
Hey!
And Dr. Mukit, who is our ENT resident.
Have you seen the video bilateral? Yeah, like a form first on one side? Yeah. So it's like the other side. Yeah.
It's Dr. Napoli and Dr. Bora with Dr. John Wessel.
Yeah, I do my glasses.
So now we're heading over to the recovery room. This is a recovery room with Lynn. We have a couple patients post-surgery recovering. Patient just had his cleft lip repaired. He's resting comfortably in Lynn's good care. That's Lynn.
Can I take a kid home with me?
Sure.
That kid who just went in, who really needs major surgery.
Yeah, he's cute.
He's so funny. He's like kept us amused a lot.
Mm-hmm. Just locked.
I'm not sure why that is.
Look at it. It's a very spacious recovery room. This is our little lounge with Tim and Shinjuti. Did they change the water? Down here is our storage room, as well as the autoclave. And there are some goats outside, which you can probably hear. Sadar Hospital is about 60 years old. And it's actually named after a general surgeon who was murdered by the murdered by the Pakistani army during the war for liberation.
Temporary tongue depressor because they want to look around his mouth and figure out what's going on.
So that was the OR. Now we are walking to the ward where our patients are. As you can see, this is a hospital. We're now going to enter the patient ward. See how everyone's doing. This patient had a cleft palate repaired yesterday. Akaro? Honey? Good. It's okay. Well, it's okay. It's okay. This is another cleft palate baby. So this ward was full, but it's our last day of surgery, so a lot of the patients have already gone home. This one is a little fussy. Sweetie. Had a lip repaired. And this is a young man who is going to be having his surgery in a little while. And his father. is Morphe. This was my first patient of the morning. He seems to be doing all right. He had his lip repaired this morning by myself and Dr. Tanchik. This is another one. Good. And some more patients. Oh, it's cute. Okay, okay.
Good afternoon.
Hello, Assalamualaikum, how are you? Hi, sweetie. And this is another one of my patients who had her lip repaired a couple hours ago.
Very good.
Dandava.
Thank you.
Seems to be doing all right. Probably a mom of a patient sleeping. They've been waiting for the surgery for quite some time. This looks like another patient immediately post-surgery. Earlier today, it looks like Dr. Bora's case, which looks awesome. That's one of the nurses. All right.